Howdy, y'all. It's Dr. Jarvis, and I want to provide a really quick update on the rapid antigen testing videos that Mike and I put out yesterday. And I want to do this because we have had some questions pop up since we put those out, and I want to address them really rapidly. So number one is about what took us so long to implement these tests. You may be asking, rightly so, why haven't we been doing this all along? Because it makes perfect sense. That is a really good question. Why haven't we been doing it all along? Because honestly, we should be doing it everywhere. We should be doing it in our schools. We should be doing it in our systems. We should be doing it at work. We should be doing it at airports. We should have tests everywhere. Why don't we? Why didn't we? Because the tests weren't available. Now, early on, there were some antibody tests available, a little finger stick test. Those are not the same as what we're using, and we can't use them for our purposes. They just show that you've been exposed, and they really don't help us. Now, rapid antigen tests have just become available. Now, I realize that you may have heard of some departments who have had tests longer than we have. Maybe they have. We have not been sitting on a cache of tests that we just haven't been using. We got a stash of these tests from the state last week, maybe. Basically, we implemented or are implementing this absolutely as fast as we can because we have wanted to do this for a while, but we just haven't had availability of tests. Now, there are a couple of things that we had to lay out and we had to plan for before we use this. We can't just get the test and start using them. Why can't we? Well, one, a helter-skelter approach like that is going to cause a lot more questions and a lot more frustration than if we actually plan on what we're going to do and how we're going to do that. And that took us a few days. So now we have a good understanding of how we're going to use it. We have come up with a plan. Number two is that the federal law that authorizes purchase of these tests and distributions to states says that we have to report the results to our local health officials of every single test. And it lays out in painful detail what you have to report. It is possible that there might be other departments who have easily been able to hit all of these reporting metrics. But it's also possible that perhaps they might not know that it is a legal requirement. Either way, we do know, and we have to make sure that we have the capability of getting the information we need on the number of tests we're going to do every week and legally report those as we're required to do. That took us a little while to build the digital infrastructure to report on this. So Danny has been hard at work building that, and now we have a system in place that is going to allow us to capture the data, everything that is required by law, and not one thing more, because we're not trying to increase a burden on anybody. We don't want that. We just want to make sure we can get the test out. All right, so that's number one about why it took us so long to get there. Again, we all wish we could have been doing this a lot earlier. Next, a question is, if we're implementing weekly testing for everybody, that must mean that we don't have faith in the vaccine. If we're vaccinated, what do we need to test for because the vaccine's going to prevent it? I think that's a reasonable question, and I can understand why you might have it. And in order to answer it, I think we need to be pretty clear about why we are testing weekly and what the vaccine does. So let's first address what the vaccine does. We know, and I feel very comfortable, that this vaccine is safe and efficacious. I feel so comfortable that I got it. I'm now fully immunized. I am getting my family. My mom just got her first dose. My dad has gotten his dose. I'm trying to get as many of my family immunized as I can. And I'm obviously urging other people to do it because I think it's safe and efficacious. But I think when we say it's safe and efficacious, the safety part I think makes sense. But what does efficacious mean? It means that it is preventing, as defined in the trials, preventing symptomatic COVID disease. And the way they defined it in the trials is a positive PCR test plus symptoms. So by definition, they were not looking at asymptomatic positives. This wasn't about protecting against just tests. It was about preventing disease, and that's really, really important. But it leaves a really big question, and that is this vaccine preventing asymptomatic test positivity, so asymptomatic disease, and most importantly, asymptomatic transmission? The reason they didn't look at those things is because that's not what the FDA wanted. The FDA was most focused on the vaccine manufacturers testing the thing that was most important, and that is keeping people out of hospitals. So they didn't look at asymptomatic spread. You may have figured out, with now over 400,000 people dead just in the US from this, and you've probably heard that is more Americans dead than we lost in all of World War II. We were very focused on decreasing death and disability and serious illness, so that's what we were focused on. Now the question moves to, well, that's great and all, but what have you done for me lately? Now I want to know, does it prevent asymptomatic spread? And I want to know that as much as you do, but we just don't have the answer yet. Now, we have every reason to think that it does. We have every reason to hope that it does, but we don't know that it does. And we can't build plans on how we're going to protect ourselves, our families, and our communities. We can't build those plans on hope. We have to build them on evidence. And we just don't have that evidence yet. So why is asymptomatic disease, asymptomatic spread important? Because we now know that the majority of COVID transmission is done by asymptomatic people. We are spreading the disease before we know that we have it. And this is completely unlike what we see with influenza or other respiratory viruses. And that is really what is at the heart of our problems fighting this off. That's the reason we have to wear masks and stay apart from each other and stay out of bars and stay out of airports, because we don't know when we have the virus. And we don't know if this vaccine prevents against it. So we have to assume that we still have the ability to transmit a virus that we don't know we have, even though we're fully vaccinated. So how do we prevent that? Well, we wear masks when we are around other people. We stay as far from other people as we can. And as soon as we have the ability to test, we test as many people as we can, as frequently as we can. And in my last video, I think I went over why we're doing weekly testing for a test or with a test with lower sensitivity. And again, we're doing it weekly to increase our sensitivity from what the test offers by itself and to catch those asymptomatic diseases. And again, we're doing this and we're still asking you to do weekly testing. We are still asking you to wear a mask. We're still asking you to socially distance, not because in this case it's protecting you or me, but it's because it is protecting our system, it's protecting our families, it's protecting our community. When we get to the point where we have herd immunity, and the proportion, by the way, of the community that needs to be vaccinated to achieve herd immunity varies based on something called the R0 of the virus. And that's the transmission, the reproducibility factor. And once, based on what we know of this virus, we need between 75 and 85% of the community vaccinated. And we realize that's going to be a harder lift right now because we are not vaccinating children yet until we get evidence that it's safe and efficacious to do so. So until we reach herd immunity, until we get really good evidence that the vaccine does prevent asymptomatic transmission, we have to keep doing the masks, the social distancing, the avoiding crowded places, and now that we have the ability, we need the mandatory testing. And I guess that's the last thing. Another question came up is this testing required? And the answer is yes. And it is required, again, to protect our system, because our core mission requires we have y'all healthy and ability to take care of our community. So yes, the testing is mandatory. So we got the test out as soon as we possibly could. We are continuing to test and require mask use because the vaccine works, but we don't know if it works on asymptomatic transmission. We just know that it works for symptomatic disease. Guys, I hope this has answered your questions. If you have any other questions, please feel free to reach out. Let me know, let Mike know, and we'll try to make sure we get the answers out to you. Thank you, as always, for everything you're doing. I know these are trying times. I know that this disease is making your job more difficult. I really appreciate and am inspired by what you're doing every day. Thank you very much.